If you're looking for the best second trimester pregnancy ball exercises, you're in the right place. My name is Jessica Babich, and I'm a doctor of physical therapy practicing in New York City. In today's video, I'm going to guide you through my 3 top exercises for people in their second trimester of pregnancy. I'm going to show you exactly how you can do these so you can do them on your own at home when you have time. Try to do these at least a few times a week to optimize preparation for birth and the changes your body is going to go through. So as a pelvic floor physical therapist, my favorite 3 exercises for women in their second trimester of pregnancy are: number 1, the seated belly pump; number 2, the tall kneeling pushdown; and number 3, the hands and knees weight shift. These 3 exercises help to strengthen and to stabilize your core, as the added pressure from pregnancy can make your core weak. Let's dive in. First, the seated belly pump. A belly pump is a great core exercise to do in pregnancy. It's actually activating the deepest part of your core muscles because we're using our breath to get a nice lengthened inhale, and then we're thinking about hugging our baby and using our exhale to pull our belly in, and that will engage our deep core. So how you do this is you're going to sit on the ball, and then you're going to have your hands around your waist or around your rib cage. You're going to inhale fully into that 360 breath, let your belly open, and then the exhale, you want to do a shush sound, and think about pulling your belly button in towards your spine and hugging your baby. You're going to try to hold that for 4 seconds and then let it go and relax completely. So we're going to inhale again, let the belly expand, and then exhale. Hug your baby, pull your belly in. Hold it for 4 seconds and then let it go. If you want, you could add an added challenge since you're on the ball. We're going to inhale fully. Exhale. Hug your baby and do a little bit of bouncing just to challenge the core and pelvic floor against gravity. And then let it go. Next, I want to show you the tall kneeling push. So this is how you do a tall kneeling push. I love this exercise because we're practicing a stacked neutral alignment and we're getting our core to engage automatically. And tall kneeling is also just a great developmental position. So what you want to do in a tall kneeling position is you want to make sure that your ribs are over your pelvis. Yes, as we get bigger in pregnancy, the tendency is going to want to lean back, but I want you to think about stacking so that your rib cage ring is right on top of the pelvic ring, and so that your baby can really be engaged inside the pelvis. You're going to have the ball in front of you, and I'm going to have you inhale fully, nice big 360 length, and then exhale, push down on the ball. And when I push down on the ball, I should feel my abs pull up and in. And then I'm going to hold. And then let it go. Inhale. And exhale, push down on the ball. And again, that push creates that automatic core engagement where my abs are pulling up and in, or I'm hugging my baby. And then let it go. This is a great exercise because we're getting that core to engage without stressing the abdominal wall. So let's do that again. Inhale fully. And exhale. Push down on the ball, get that automatic pulling up and in. You can challenge this a little bit more by continuing to push down on the ball and doing a little roll forward. You could do a little roll side. And then we're just challenging how our core is handling different forces, side to side or front and back. Finally, I will guide you through the hands and knees weight shift. So this is one of my favorite exercises because it helps stabilize your pelvis. Often in pregnancy, we feel a little bit looser through hormonal changes and postural changes. So doing a prolonged hold helps to kind of get your core to kick in automatically. So if you feel any low back pain, pelvic pain, or pubic bone pain, this can be a great one. I usually recommend holding this exercise for 90 seconds because it takes that long for your endurance muscles to kick in. As a reminder, this is called hands and knees weight shift. So what you're going to do is you want to be somewhere near a wall so you can put the pregnancy ball against the wall. We're going to come into a hands and knees position. When you're in that position, you want to make sure that your sit bones are engaged against the ball, against the wall. Now, if your wrist hurt in this position, you can always make fists. You can put some toweling under your wrist to avoid all the extension, but you want to come into a hands and knees position with a nice long neck, neutral spine, sit bones wide against the ball. I'm going to inhale fully, and then exhale, push and weight shift back into the ball against the wall. So I'm performing a little isometric contraction here. And when you do this, you'll actually feel a lot of automatic core work and it'll feel nice and strong. And you can hold here and breathe and make sure that you're not holding your breath because we don't want to strain it all. So again, doing this prolonged hold for about 90 seconds will help you to feel more stable. You can make this more challenging by doing a little arm raise out to the front or out to the side, and you'll really feel work in that other arm as well as the core. Or you can just simply hold it. Remember to save this video so you can repeat the second trimester exercises a few times a week. And once you are in your third trimester, I have a video for that as well. If this video helped you to feel informed, confident, or more hopeful, hit like and subscribe and share this with someone who is on the journey too. If you have any questions, be sure to drop them in the comments below and I will do my best to answer them in future videos. And if you live in New York and you'd like personalized guidance or to work with me in person or virtually, please check out the links below. I'm Dr. Jessica and I'll see you in the next video.